Welcome back. So to continue on from where we left off in our discussion on the relative radiosensitivity of organs, we are now going to discuss the central nervous system sensitivity. Now, the central nervous system is considered to be relatively radiation resistant. Patients receiving large doses to the brain or the spinal cord during radiation or radiation treatment will develop myelitis over several years, but only after exposures of 30 gray or more. Radiation can cause temporary or permanent damage to the nerve processes, and when this occurs, communication with and control of some areas of the body may be disrupted. Whole body exposures to very high doses of radiation causes severe damage to the central nervous system. A single exposure in excess of 50 gray of ionizing radiation may lead to death within a few hours or days. And how about the reproductive system's sensitivity to radiation? Even small doses of ionizing radiation could have some sort of effect. Now let's look at the male. The male testes contain both mature and immature spermatogonia. The immature spermatogonia are unspecialized and they divide rapidly, and therefore these germ cells are extremely radiosensitive. A radiation dose of 2 gray may cause temporary sterility for as long as a period of 12 months, and a dose of 5 to 6 gray can cause permanent sterility. When looking at the female, the ova, the mature female germ cells, do not divide constantly. Now, after puberty, one of the two ovaries expels a mature ovum approximately every 28 days or so. Radiosensitivity of the ova varies considerably through the lifetime of the germ cell. Sensitivity will depend on age, and women older than 30 years are more sensitive to doses above 2.5 gray. In the text, it also mentions that small doses of ionizing radiation could cause menstrual irregularities, such as delay or suppression of menstruation. In general terms, whenever chromosomes in the male or the female germ cells are damaged by exposure to ionizing radiation, it is possible for mutations or hereditary damage, such as congenital abnormalities, to be passed on to succeeding generations. Moving on to glandular tissue, we have already discussed some concerns with regards to accidental release of radiation, specifically radioiodines from nuclear facilities, and the exposure and potential damage to the thyroid gland. But what about the breast? How could this be affected? The link between radiation exposure and breast cancer has been demonstrated in survivors of the atomic bombing in Japan, particularly among women who were younger than 20 when the bombs were dropped. The effect of the radiation exposure was especially strong for women whose age of first occurrence of menstruation was 12 or younger and who were exposed by the age of 20. There is a significant dose relationship between the dosage of childhood radiation and the increase in the incidence of breast cancer. Acute irradiation syndrome to the entire body will be discussed in subsequent lectures. However, this gives you an idea of the radiation dose required to cause a severe or acute response to the entire body. And specific organs are included here, like bone marrow. 1 to 10 gray will result in an acute irradiation syndrome. The GI tract 10 to 50, and the central nervous system has to be above 50 gray to cause a severe or detrimental effect. Now, with the acute radiation sickness or syndrome, things that people would experience would most likely be weakness, fatigue, dehydration, diarrhea, bloody stool, fever, hair loss, to name a few. And then when you're looking at chronic irradiation or late deterministic effects, these include things like muscle and skin atrophy, cataracts, and even cancer. Now, although the sensitivity of the gastrointestinal tract will be brought up again in subsequent lectures under acute radiation syndrome, I thought I would mention it here as well because it is on the sensitivity or the organ sensitivity chart that we brought up earlier in this lecture. Now, sensitivity of the cells of the GI tract is similar to that of the skin cells, and ulceration followed by fatal dysentery is what happens to you if a large part of your intestine is exposed to acute doses of radiation above 10 gray. Doses greater than 1 gray could cause temporary nausea, vomiting, and diarrhea, so it still does have an effect on your body. So what is the potential risk of the damaging effects of ionizing radiation in the diagnostic imaging field, in our field, just taking X-rays on a regular basis? Well, there is a relative assumed risk, and this is completely linear. This basically means that the biological effect and the radiation dose are directly proportional. For our sake, it is always better to overestimate the risk than underestimate the risk, and practice in a safe manner, making sure that we reduce our time, making sure that we keep our distance, making sure that we shield ourselves and our patients. All of these things are important in the imaging field. So we know that all radiation exposure levels possess the potential to cause biological damage. And as imaging professionals, we must never fail to employ aggressive radiation safety techniques during our diagnostic imaging procedures. Now, numerous studies, however, do indicate a decreased blood count and chromosome disorders received from radiation doses within the diagnostic range. This has mostly been linked to high-level fluoroscopy procedures with long exposure times, such as cardiac catheterization procedures and other specialized invasive procedures. Now, the chance of radiation-induced cataracts occurring as a result of a diagnostic imaging procedure is quite rare, but it is possible for it to occur. Fluoroscopic procedures, as mentioned, does have high doses, and this can cause a high dose to the lens of the eye. Now, our occupational dose to this very sensitive area can be substantially reduced when we wear protective eyewear, and that eyewear I'm referring to is the lead glasses. In patients, the exposure to the lens of the eye can also be protected. We can give them lead protection glasses as well, but we can only do so provided that the shields do not compromise the diagnostic value or does not interfere with what they're trying to see on the image. So in summary, I'd like to reiterate or drive home a few points. It is important to remember that when the cell nucleus is significantly damaged by exposure to ionizing radiation, that the cell can die, it can experience reproductive death, it can undergo mitotic delay, interference with the function of the cell, or it can undergo chromosome breakage. The law of Bogoni and Trepidot identified for us that the most pronounced radiation effects occurs in cells that have the least amount of maturity and that are undifferentiated or not as specialized and that have the greatest reproductive activity. We determined that the young is mostly susceptible to radiation damage simply because their cells are still growing and are immature. Lymphocytes, we found out, are the most radiosensitive blood cell, and when they are damaged, the body loses its natural ability to combat infection. Our immune system becomes depressed, and we become more susceptible to bacteria and viral infections and antigens. Radiation organ sensitivity tables are out there that allows us to differentiate between organs that are more radiosensitive than others. Please do refer to that chart. It will come in handy when you're doing calculations as well. We also discovered that certain organs, as we know, based on that sensitivity chart, is more sensitive than others. CNS is considered to be, or central nervous system, is considered to be very radio resistant. And human germ cells are considered to be relatively radiosensitive. Because when you think about it, 2 gray is quite high in terms of exposure, and temporary sterilization occurs at this level. The body can still recover from that at this level of exposure. So moving along to the end of this presentation, I've got a few review questions I would like you to try out. I want you to put these organs that you see in front of you in order of radiosensitivity, that being the most sensitive and least sensitive. What factors do you consider when making your list? And in addition to that, I've got a few simple questions as well for you to answer at the end of this PowerPoint. All the information you need to answer these questions can be found in the textbook. There's also a good YouTube video online titled, "What Does Radiation Poisoning Do to Your Body?" I would like you to watch that YouTube video as well. If you have any questions or concerns, of course, you know that you can contact me.